That's always a very good question. What would I like to achieve?
My main goal, general goal, is to do research that matters.
To contribute in the prevention of diseases associated to the so-called development.
To identify what are the effects related to shift work and circadian disruption and how we can prevent these effects.
To contribute in the prevention of diseases associated to exposure to have levels of environmental contamination.
I can bring new insight on how environmental factors can affect the brain development in our children, and this may help to implement measures to prevent later problems, and if necessary, of course.
I just simply want that everything that we find during our research process may help people to live better.
The idea is to generate knowledge that can be useful to minimize the burden of disease associated with water-related exposures.
Our motivation in the long term is to improve the protection. One very important aspect is protection of patients, especially children who receive medical radiation exposure.
We don't want to have high air pollution levels in cities. We don't want to have high noise levels in cities. We want to have more green space in cities. Hopefully this is what we actually can pick up from what we've learned here in Europe and apply it to cities outside Europe.
I really hope that in the end we can make a difference by doing this work and the hard work of following mothers and children, that we can really make a difference to the lives of those children or the children of the future generations by preventing some of the environmental hazards.
Many of the populations in the future will be live in cities, and if we can start to include the health concept in the design of the cities, we can improve the public health, we can prevent many diseases and deaths in the future, and we can create a more healthy populations.
I guess we're always looking forward to try and establish causality. So we'd like to really look at what types and how much and when physical activity could be done that could be used in the most optimal way to improve health.
Fix some knowledge gaps and increase the awareness of the potential implications that air pollution can have on child's brain development.
Trying to fill in some of those gaps. So doing environmental epidemiology in these places where we have still relatively very little information on the exposure levels and their health effects.
The translation of this into changes are related to two types of actions.
We can develop, for one side, public health strategies to control these exposures.
Most of our projects we work with stakeholders, so we work with people that can make changes in the cities.
The final idea is to create some recommendations for the decision makers to tell them what they could do or which way they should take to improve people's life.
But also there are implications at individual level for all of our society. So this is a big challenge. First, because the resilience of the community to move and to undertake actions, but also because of the resistance of the individuals to change their behavior.
So I think it's very important to establish a dialogue with the populations, and to basically provide them the means to know what are their exposures and what they can do to reduce them and better understand what the risks are. Because if you don't understand the risks, then basically you live in fear, in uncertainty all the time, you can't take measures, you can't take control of your life.